Hello, and welcome to the Digital Workspace Works podcast. I'm Ryan Purvis, your host, supported by our producer Heather Bicknell. In this series, you'll hear stories and opinions from experts in the field, stories from the front lines, the problems they face and how they solved them, the areas they focused on from technology, people and processes, to the approaches they took that will help you to get to the grips with the digital workspace inner workings.
I've only got 9 minutes.
That's fine. We'll do a very quick one as a teaser to talking to Martin about health and digital transformation.
Yeah.
So tell your story again from the beginning.
Okay. So digital transformation in health. One of the things that you always have to remember is the NHS is set up for universal access at the point of care delivery. And sometimes people's thoughts around digital transformation in health get in the way of that. So as an example, my wife went into our GP surgery 6 months ago and was standing at the desk, and there was a lady who was probably, she said, in her 80s, talking to the receptionist, trying to book an appointment. And the receptionist said back to her, "You can't book an appointment with me. You need to go on to Clinic in order to book the appointment." So the lady said, "What's Clinic?" "Well, it's an online system." "How do I get online?" "Well, you need a smartphone." Clearly, this lady was not a person who was particularly a digital native. And within one fell swoop, you kind of opened up some of the issues around the digitization of healthcare, in that, you can make some services available for people who are able to consume and use those services and feel very comfortable doing it. But on the other side, what you can't do is marginalize or exclude people who struggle to use those services. So you have to maintain that view that we are going to give universal access to healthcare at the point of care delivery for all. That has to be the true north in any digital transformation. You have to have a consistent level of service for people, no matter what their circumstances are.
Yeah, you got to meet them where they are and go through the channel where they are in some respects, what they're comfortable with
and
or capable of.
Yeah, and sometimes you can think about different ways of achieving that. So when I was in housing, for example, and we knew that rolling out new digital portals for some of the residents was going to be challenging for them, and especially in South Asian communities where English may have been a second language, may not have had cell phone access, but also, some of the other issues to do with digital poverty and that exclusion from being able to get the best rates or whatever it is. We took the decision to provide mobile training in estates for those people, to try and get people trained on how to use a laptop, how to access services, and then work with other organisations such as BT and Microsoft at the time to provide access to low-cost devices to get people online. And then also at that point in time, getting low-cost broadband. So you do have to think about this from an end-to-end perspective in terms of when you are providing services to a community, how do you make sure that that community is going to use and consume those services? And if they're not digitally savvy, still, how are you going to provide those services? You need to think about things in a slightly different way.
Yeah, no, I hear you. I mean, we've been fascinated. So we've joined our local surgery now since we've been back, and they have the app, they have the website, they have all these things you go to get you online. But every time we want to do something, you have to go back into the surgery, fill in a whole lot of paperwork, show proof of council tax, your passport, all the rest of it. And it's like, what's the point of being digital? Everything is still paper-based. And then you can't use the online booking system to book a GP appointment. You have to phone in still. because what they do is they use the online booking system and only allocate people that have phoned in the opportunity to book an online appointment. So it's madness, absolute madness.
Well, yeah, and you also. So I had to order this morning from my GP service some repeat prescription or a prescription for severe hay fever, and the solution that they've gone for is so counterintuitive. It's beggars belief. So I'm presented with a calendar that says, please type in the dates dates and times you are not available, and you have to do this in 1 hour slots for the next month. And the thing that really irritates me is my guess is that was thought of a really good idea by the team that were doing the implementation, but they never actually used it themselves, because had they used it once, they would have got intensely frustrated with it and realised, actually, that is not making things really easy and simple for the patient in terms of how to book. So the other way round, much simpler. Tell us when you are going to be available over the next 4 weeks. Much, much simpler.
Yeah.
So there isn't, and this isn't the fault of healthcare professionals, because healthcare professionals were never designed to be A, business owners, and B, experts in digital transformation. But the feedback loops are not always great. And the other aspect in terms of what you've just talked about is data in healthcare is really, really fragmented. And there are companies that are trying to address that and making a lot of money out of it by orchestrating health data around local geographies.
Yeah.
But the danger in that is over-presenting data, because when you're a clinician, the thing that you need is data relevant to the treatment that the patient needs that's in front of you. You don't need the history that, when that patient who's now 70 was 6 years old, they broke their arm. Actually, you need to know data that's relevant in that moment. And so that's also a challenge in terms of filtering that data for clinical relevance. So really interesting challenges ahead, but I think once it's nailed, the prospects to become a true data-driven healthcare system and unlock all of the benefits that entails are going to be immense.
I agree. I mean, if you think about just having, I know you need to run, the ability to use pattern recognition and wearables and feed that into your different appointments you have in context, it'll be amazing if it works.
Well, yeah. So there's a lot at the moment. We tend to think about the healthcare system is broken, is underfunded. There are not enough people to meet the demand of the system. But actually, I think you need to break that down and have a look and say how much of the demand that happens from patients is a result of failure demand, and how much of it is actual, I've got a new problem that needs sorting, as opposed to I've had a problem and I've been to you 3 times before and it's still not been fixed. And I think what will be really interesting as we get into those data-driven services that will really help reduce failure demand, we'll see not only improvements in patient outcomes, but also additional clinical paper in terms of being able to meet capacity needs.
Yep. Yeah. No, agreed. Well,
anyway, I've got to jump.
Yeah. Super. Well, we'll schedule a proper call when you for a couple of weeks from now, whatever.
Yeah, that'd be good. All right.
Super.
Take it easy, Ryan.
Thanks, Ryan.
Cheers. Bye.
Cheers.
Thank you for listening to today's episode. Heather Bicknell is our producer and editor. Thank you, Heather, for your hard work on this episode. Please subscribe to the series and rate us on iTunes or the Google Play Store. Follow us on Twitter @the DWW Podcast. The show notes and transcripts will be available on the website www.digitalworkspace.works. Please also visit our website www.digitalworkspace.works and subscribe to our newsletter. And lastly, if If you found this episode useful, please share with your friends or colleagues.